here. I just wanted to share with you that the fats that you're eating may be leading to things like dementia, cardiovascular disease, and diabetes. I know we don't really think about fats with diabetes or dementia for that matter, but your brain is made of fat. And these fats need to be in a specific ratio in your body to have the most optimum health, to have your greatest amount of health. So we have omega-6s and omega-3 fats. And the omega-6s tend to be inflammatory. So they come from things like safflower oil, corn oil, sunflower oil, vegetable oil, things like that. The omega-3s, on the other hand, come from things like walnuts and flax seeds and your algae like chlorophyll and spirulina, and even some green foods have the omega-3 fats in them. So it is important to have a good ratio in your body so that you avoid things like cardiovascular disease and depression and dementia and diabetes and even infertility. This is a huge thing. So we don't really think about fats relating to infertility, but it actually does, because when we have inflammatory fats, a high inflammatory profile in our body, our hormones aren't working right. Our hormones are also made with fats, so it's important to, again, to have that perfect ratio. And the thing is, these fats, the omega-6s and the omega-3s, they make a conversion into what we call prostanoids, or just think of a usable form, a healthy usable form of the, it doesn't actually have to be usable, but into a different form. And when these fats are transitioned into a form that your body can use, it takes micronutrients. So it takes glutathione, it takes choline, it takes magnesium, it takes selenium, and things like that. So if you're deficient in any of those factors, those micronutrients, then you're not really going to have this conversion take place, and then your ratios are really going to be off, and you may be setting yourself up for even more inflammation in your body. So again, this is why you probably already know I'm doing the micronutrient test in my office on April 2nd. But I'm also inviting you to do the Omega Check, because this is one of the most important things in our body if we want to reduce inflammation, reduce our potential for dementia. I have some traumatic brain injury patients that I'm working with now, and this is a huge piece for them. So if you've had a concussion, or you've had any kind of brain trauma, or if you have a history or family history of Parkinson's or Alzheimer's or things like that, I encourage you to get your omega ratios checked, your omega ratio fats checked, omega fat ratios checked. Anyway, you get where I'm going with this? All right. So there's still room if you want to sign up for, get yourself registered and get your blood drawn for our day, for the blood draw day. And I'm doing this as a group, so it really reduces the price on these kinds of things. So anyway, to your health, people, mwah, love ya.